News Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello and welcome to New Skills for Living, a show dedicated to healing and wholeness in our community. Today's show is part of our series on addiction recovery, and today we're going to focus on problem gambling. So you'll want to watch our show today if you've been concerned about a loved one who might have a problem with gambling. Maybe you're a family member or a friend, or maybe you yourself, you've questioned your own gambling habits and you've wondered if you have a problem, or if you do, where you can get help. And so you'll want to watch our show today. We have an excellent expert guest with us today, Denise Quirk. Denise is the Chief Executive Officer and the Clinical Director of the Reno Problem Gambling Center. And the Reno Problem Gambling Center is dedicated to helping those people that have a gambling problem, as well as helping their family members. And a great thing about their mission is that they treat people regardless of their ability to pay. So Denise, thank you so much for joining us today.
Thank you, Tom.
Yeah. So I think, Denise, it's a good place to start off. People might be wondering, like, well, how do you define a problem gambler? When is someone having a problem with gambling?
Yes, I think since a majority of our population gambles recreationally without ever having an issue, discovering that you have a problem can be quite shocking. For most people, there are certain elements. Number one, I've noticed, is lying. If a person is lying to themselves or others about any aspect of their gambling, if they're hiding or sneaking, there's probably a problem. If they are starting to bet more than they intended to, if they had a budget or a plan and they've gone out of that plan, if any kind of borrowing to finance gambling is going on, that is likely a problem. If it's not within your budget, it could be an issue. Yeah. And then, of course, the worst case scenario for a lot of people is that they are losing time with their relationships, their job becomes jeopardized, other social events in their life, or worst case, they steal or do things that they would have never intended to do because of their gambling.
Denise, as you're going through that, I'm kind of imagining that those are the kinds of questions when someone comes in and they're wondering if they have a problem. You probably ask them those questions, huh?
We absolutely do. We have a number of assessment questions that we ask, and we try to gain a history and a perspective of why that person is here now. Because as a general rule, the folks I'm seeing are in some kind of crisis when they come to me.
Denise, have you seen, does someone just start off being a problem gambler usually, or do they kind of like build up into that over the course of time? What have you seen in all your years as a therapist?
Generally, Tom, it's a course of time. People start out gambling for fun. It's a form of entertainment. Some event quite often triggers a person developing an issue, a problem, or an addiction with gambling. For example, if a person has a big win, if you win a month's worth of your salary with one pull of a handle, that's going to cause a cascade of emotional and mental events to occur, and irrational thinking tends to creep in. For example, you may start to think that you can do that, like I have some special ability to repeat that event, when it's just chance. Yeah.
And is there a chemical factor involved? I've heard that there's a factor of dopamine that might be involved with some compulsive gamblers. Is that your experience, and is that part of your like biopsychosocial model?
Yes, when I'm taking an inventory of what a problem gambler has going on in their lives, I'm asking them what kind of changes they've had in their lives, and I'm assuming that if they have gone all the way down into some crisis around their gambling, their brain has changed, because like other addictions, switches happen, and your brain is being bathed in chemicals that are triggering you to want to go out and do things that you would have not normally ever had any trouble controlling. And that's usually a keen indicator of an addiction, that people are doing stuff that they used to be able to control.
So someone who's a compulsive gambler, Denise, are you saying that they experience a high, and when they're away from gambling, they're kind of craving getting involved in that activity again so they can get high again from gambling?
There's a number of kinds of gambling that I see. Not only the euphoric high that you're describing, especially around a big win and chasing that. There's also escape gamblers. The majority of the women that I treat are trying to escape some uncomfortable situation, a loss especially. and they just want to get away, and that machine can often provide them that escape that they're seeking.
Yeah. So it's like a maladaptive form of coping with grief and loss,
Absolutely.
or stress, or lack of fulfillment in a marriage. Something
There's
like
that.
Yeah. Okay. We have about just a minute right now. Can you describe to us like a typical person who comes to Reno Problem Gambling Center?
Because women have a greater tendency to seek help when they realize they have a problem, we have a few percentage points more women. We have about 51% more women showing up than men. They tend to be middle-aged. They tend to be employed or recently having lost their job. They tend to have about $25,000 in gambling debt by the time they get to me on average.
Yeah.
So it's a wide range of horrible gambling debt. So they have severe financial problems.
Yeah. Well, I want to catch up with you right after this brief break and find out more about the individual and more about the family too. So we'll join Denise right after this brief break. Hello and welcome back to New Skills for Living. You'll see up on your screen that information on the website www.easeap.com, where you will be able to see this interview with Denise on problem gambling, as well as other interviews that we've done on addiction recovery. And then I also would like to show you, this is a sample of the newsletters that are available on that website. There are over 80 newsletters addressing stress, anxiety, depression, healthy relationships, making amends, forgiveness, those types of issues that you can pull up and read or forward to friends or make copies and share. So we want to turn our attention back to Denise Quirk, our guest. And Denise, I'd like to hear from you about families and how families are affected by compulsive gambling, and then how do you help them?
Thanks, Tom. My greatest concern as a marriage and family therapist is how many untreated family members there are. For every one problem gambler, there are likely up to 7 family members being affected. So quite often I'll see the spouse, and let's say it's a woman, and she comes in and says she's horrified that she's found out that a huge amount of money is missing. When she confronts her husband, he admits that he's gambling. She's got trauma, anger, betrayal, sadness, fear. She's got a number of natural emotions that to respond to that. She may not know that her mental health needs at that moment are just as important and sometimes worse than the situation that her husband is in as the pathological gambler. So I want to assess and invite all the family members to come in and talk to me and make sure that we're offering them the things that they need. And one of the ways we do that is through individual, family, couples, and group counseling. And we do all of that in an outpatient setting at the Reno Problem Gambling Center. If there is a greater need for residential treatment or some other kind of comorbid issue, such as their own addiction or their own extreme mental illness that needs a greater level of care, we'll refer them out to the appropriate agency.
That's great. So there's not just one person then, is it? There's a ripple effect throughout the family and maybe even throughout the workplace or throughout the church.
Sure.
Like you were saying, so many people feel betrayed.
Yeah.
So can you tell us a little bit more then, what are the key issues that a family member needs to address for them to get into recovery?
Thank you. I think shame is an element that occurs for both the gambler and the family member. And as I do the family group on Tuesday nights that has both gamblers and family members present, we quite often return to the issue of shame and anger. Those two come up more than anything, and I can understand how uncomfortable it is for a family to try and deal with the loss and the change that occurs even when a person is in recovery and doing well. Then there's this whole new behavior of going to meetings and coming to therapy and things that they never used to do before. So there's a lot of change that the family has to deal with.
Yeah. Can you tell us a little bit about maybe how small children or teenage children might be affected by this, by the gambling and the marital distress?
And thank you for asking about that, Tom. There's a wonderful film available through the Nevada Council on Problem Gambling about adolescents in particular. When you picture, for example, 2 children in their teens and their mom is struggling to make ends meet and at the same time has a gambling problem and is hiding the debts, and the phone's ringing off the hook, and mom's bouncing checks for music lessons or soccer or whatever, how horrible it can be for children who are making excuses and dealing with their own frustration and fear. It definitely affects families on a lot of levels.
So kids might have problems with their siblings or with their peers at school, or they might decline academically. You know, you talked about shame, Denise, and so could you tell us a little bit about how important confidentiality is for clients at the Reno Problem Gambling Center? A little bit more about the therapy that you do.
Thank you. We are expert professionals who have dealt with this addiction and other mental illnesses for a combined 50, 60 years if you put all of our experience together. Confidentiality is of the utmost. We have had a number of people who are extremely fearful about their name getting out into the community for coming into treatment. We do our very best, and we're experts at keeping all of those confidential names and identities completely secret. So we want to make it as comfortable as possible for a person to come in and be able to disclose what they need to talk about.
And really deal with their issues so that they can have a great life and not be dragged down by this addiction.
For sure.
Yeah. So can you tell us a little bit about what are the main 3 or 4 issues that you find come up underneath the addiction that people process with you, Denise?
Well, I've already mentioned, I think, the ones that are of the utmost importance to immediately address, and that is the shock and the trauma. For some people, that could lead to suicidal ideation, both for the family member and the gambler. So we're continually assessing whether they might be suicidal or homicidal, because believe it or not, completely sober people with no alcohol or drugs on board might be contemplating those things, and we want to check that out regularly. We want to check out their financial distress and offer them as much financial education and support as we can. So we guide them through that process. And we want to constantly check to see what their emotional, physical, temporal needs are. We've had a number of homeless people that have come through our doors, as well as a number of very wealthy people who just need help managing.
That's some really good information, and you'll see on the table there are a number of booklets that Denise has brought. We're going to investigate those tools that are very helpful to people right after this brief break. Hello and welcome back as we continue to talk with Denise Quirk from the Reno Problem Gambling Center about recovery from addiction to gambling. So Denise, you know, the Reno Problem Gambling Center has a great reputation. It's been in the community a lot of years. People really respect you and your staff and the work you do. What are some of the things that you hear from your patients or your clients about the work that you do that they like or that they appreciate?
I think our clients mostly appreciate the initial, from the first phone call, that there's a feeling of help and hope is available. That's part of our motto. Mm-hmm. They really get that we are experts, that we understand, and that we don't judge. They have been judged and run through some pretty difficult spaces prior to getting to us, and what we offer really works. So over a period of time, for example, our intensive outpatient program is generally 8 weeks. That's the beginning phase of really intensively addressing the addiction, putting it to rest, and starting to clean up the wreckage. After that, the continuing care phase may go on for 1 year to 2 years of, let's say, once a week or once a month, the individuals or the couples are coming in and continuing their therapy. And because we're a nonprofit, folks can make arrangements and come in at all kinds of different times, and we don't have to charge them a lot of money because we depend on donations from our donors, from our community, and from state grants to keep us going.
Yeah. So can you tell us a little bit more about the treatment program itself? So it lasts 8 weeks, the basic part. Mm-hmm. And I guess you found that intensity is really important, huh?
It is, because one of my terms is people come in with their hair on fire. They have so many stressors hitting them that push them into treatment. And it's usually the first time some of these people have ever seen a therapist and talked about it. So those first 8 weeks, we are doing a very intensive initial assessment and making sure that we're placing them at the proper level of care. We are helping them get a lot of things in order, but first of all, saying goodbye to gambling. We're helping them walk through their life story as it pertains to gambling. We're helping them get their financial history in order so that they can start working on a path of a profitable spending plan. And we're helping them develop a mental health treatment plan that's going to work for the rest of their lives.
Yeah. Now, you've got a couple of tools here. Would you want to hold those up and maybe show those to our audience? Some great stuff.
Thank you. This book is a book that's free and available through the Nevada Council on Problem Gambling. It's called In the Shadow of Chance by Dr. Julian Tabor, who, Tom, you mentioned having known because he worked at the Reno VA years ago. Yeah. We have several handouts that we use depending on what the issues are. A number of our clients, unfortunately, have legal issues because they have been caught embezzling. The law has been changed in the state of Nevada so that if the judge deems it appropriate and the person is a good candidate, he may assign a person to diversion and offer them the opportunity for their felony to go away after the proper amount of treatment and restitution and probation, et cetera. So that's a great new hope for some of our gamblers who have legal problems.
Yes.
When a number of our clients come in just not knowing what to do with their money and their finances when they first get to us, we offer them the personal financial strategies for the loved ones and for the gambler to talk about what to do with their money and who should handle it. That's a big issue when they first come in.
Okay. And then if people would like to contact you about accessing that, they can contact you through your website.
Yes.
At renopgc.org.
You got it.
renopcg.org.
It's Reno PGC,
PGC,
which stands for the Reno Problem Gambling Center.
Okay.
So www.renopgc.org.
Or they could even Google Reno Problem Gambling Center, and your center would come up.
Absolutely.
And they can get information. Now, we have about a minute here, so if someone's watching our show and they'd like to schedule an assessment or they want time to talk with you, how do they go about doing that, Denise?
Our number is 775-284-5335. We will answer the phone during business hours between 8 and 6. We are there later on many evenings, and we will work with you on getting an appointment that fits your needs, whether you're at work or not.
Oh, that's great to hear how responsive you are.
You bet.
We're going to go ahead now and take a brief break, and then when we return, we'll have our last segment as we continue to learn more about gambling addiction and recovery. Hello and welcome back to New Skills for Living. We're talking about recovery from problem gambling with Denise Quirk. So Denise, your community, your center is so much a part of the community. Can you share with us the kind of support that you and your patients receive from the community?
Thank you, Tom. Our board of directors is awesome, and they work with me and our volunteers and our staff to reach out and get our program to a level of awareness, which is our long-term mission, that everybody's going to know that it's available. Because we're nonprofit, we depend on the kindness of our community. So we have had a number of excellent responses from places like the Atlantis and IGT, just to name a few, and several other business people in the community that have given us donations at our annual luau, which we do every June. We do things in addition to fundraisers. We write grants, and we have a wonderful grant that we've received from the state of Nevada now the entire 5 years that we've been in existence, and that is our lifeblood. And although the economy has taken a big chunk of it, we're grateful to still have that grant.
Yeah, so that is just a confirmation of how important people in the community feel your work is. Now, and then people, they also can make individual donations as well?
Absolutely. We have a belief that the change in your pocket can make a difference and make great changes in our center. So we have a little jar right when you walk in that you can drop the change in your pocket if you wish.
I like that. And then you also have some volunteers that help out. Can you tell us about that?
I'm so grateful for our volunteers. Sometimes they're the friends and family or the alumni of our center. Sometimes they're students from UNR. And people who wish to come and help us in a variety of ways are very welcome, and I warmly appreciate the folks who come and give us a hand. Oh, yeah.
Now, we didn't get a chance to talk about this, Denise, but one of your important networking connections is with the 12-step groups in the community.
Yes.
Can you tell us, for the identified patient and for the family, can you tell us a little bit about that?
Indeed. For the gamblers, the 12-step organization is called Gamblers Anonymous, or GA for short. For the family members, the 12-step organization is called GAM Anon. There are a number of meetings available in our community, and thank heaven they provide a service that we cannot provide. They are available 24/7 with recovering people who know exactly what it's like. There's a number that a person can call and speak to a recovering gambler or a recovering family member and really get a feel for what they're going through and speak directly to someone who knows. So I'm grateful that there are meetings and individuals available in our community.
Oh yeah, that's great. You know, you mentioned something earlier, Denise. I was hoping you might expand on that. And I really like that when you were talking about that you and your staff are not judgmental, but that you're really based on having a compassionate response for this suffering person. Can you tell us a little bit more about that?
Certainly. That's the feedback that we've received directly from our patients and family members because of the shame around thinking that it used to be a willpower problem and then discovering, oh, this is an addiction. I have a certifiable mental illness. And then to be treated with integrity and with the kind of compassion that we have, that's what they say brings them back. It's the care and compassion that we have to offer, plus our expertise.
Oh, sure. Both of those really make a tremendous difference. Now, some of the folks that might come to you for help and they begin to recognize that they have a gambling problem, they might also then begin to recognize that they might have a problem with, through the help of you and your staff and their own insight, maybe bipolar disorder or major depression or PTSD, or maybe a problem with alcohol or methamphetamine. Can you tell us a little bit about treating a person with those multiple circumstances?
Yes, it's very important during the initial assessment that we are assessing everything that could be going on in the person's life. And quite often, in fact, 99% of the time, there's an underlying disorder of some type, whether it's just the acute depression and anxiety, or it's a long-term mental illness such as bipolar disorder. When it occurs that we find a mental illness or another addiction co-occurring with the gambling, we want to make sure that either we offer them, which we can, offer many services at an outpatient mental health level, or we immediately refer them to be detoxed at a hospital to go to the appropriate agency or professional that can be the expert that they need to help with that.
So in about 15 seconds, Denise, if someone's watching our show and they're concerned about themselves or a loved one, what would you want to say to them?
Well, I say call and talk to us. Let us help you. We listen very well. That's what we do. But we also, what we really do best is we come up with solutions that will work individually for you, and we're here to help.
Solutions and resources to help someone out of their suffering and to change their life, huh?
Absolutely.
I think up on your screen you'll see, again, that information about how you can access the EAS website, easeap.com, where you can maybe share this wonderful interview that Denise just did on problem gambling with a family member or loved one. You can go to the website and watch that on streaming video. We want to thank Denise Quirk for coming and sharing her experience and her expertise with us. And we want to invite you back to watch the show again next month as we continue to take a look at these important themes of addiction recovery. Next month we're going to have Mick, the clinical director from Bristlecone, be our guest. So we'll see you next month. And Denise, again, thank you so much for coming and sharing your expertise.
Tom.
Okay.
It's a pleasure.